Hello. That's a door thick with lead to keep out small amounts of radiation, unlike the lunar landing that was thin as a can. And that's me, Anthony, with my chemo bag in hand. I'm preparing myself to hop onto a radiation table to kill the cancer that was left into me. Due to medical malpractice and doctors that I think, in my own opinion, knew that I had cancer and didn't take the steps to prevent it, because my type of cancer is preventable if caught early enough. That is something that I did not know. However, I was left with this cancer, and my life was devastated and ruined. And now I see with my own eyes and my own experience of how ordinary Americans live out their life, with their pain and their suffering, destroying lives and families. But they always say, you never know who your friends are until you get sick, until you actually need some real help. Well, I did. But through this horrible journey, I've gained a lot of experience, and I've gained a lot of knowledge. Unfortunately, I had to be put through it in order to understand it. And maybe that's why this is like the 6th recording I've done to try to pinpoint exactly what I'm trying to tell you. I'm trying to break down this health insurance fraud, because there is no health care, it's health insurance. That means that you have to buy health insurance or pay a fine. Then they go around and tax small businesses and individuals, saying that it's for health care, when there is no health care, it's health insurance. So on top of all the other ways that they're going to make money off this health insurance bill, they are going to make money right and left and right up the center, ripping you off. And that's what I'm trying to show you. That's what I want you to understand. Why do I understand it better than anybody else? Why? Why don't I see it on anybody else's channel? I don't know. But I've been put through hell. And I'm going to show you that it's coming your way. Because not only do we have to deal with the chemicals that they put in our water, we got to deal with everything that they put in our food and plastics. My cancer is cured. Well, not cured now. It can come back, but it's family related. So I can pass it on to my other children. And the doctors 5 years ago never told me that either. So now I'm left knowing that my children have a very good chance of getting my cancer. And with that said, I gotta look out for them. And I gotta thank my wife for standing by my side and having all the love and support she's given me. That's true love. And that's how you know who your friends are and who really loves you, like my wife does. And you can't break real love. No, you can't. So with that said and everything else, I want you to sit back and follow along, and I hope that I make it easy for you to understand.
I say suck my mo titties, bitch. Right there.
One issue that the CBO really highlighted in terms of why this is happening is because healthcare costs are out of control, especially Medicare and Medicaid. And what's interesting is we just passed this massive new entitlement plan that will add about 30 to 40 million additional Americans onto the healthcare rolls of the government. It's hard to see how that's going to make this any better.
So you're saying that we passed healthcare for them that we can't afford?
Well put. We can't even afford the ones we've got already. Medicare and Medicaid already have trillions of dollars of liabilities. They're both in the red right now. And this new health care bill, by the way, adds about 15 million Americans to Medicaid. Medicaid is already bankrupting not just the U.S. government, but a lot of state governments like California and New York.
Well, I've got an idea. Why don't we raise taxes?
Well, that's the other point about this report that I found was interesting, was at the end of the report they said, you know, we could maybe deal with this issue somewhat with tax increases, but if we tried to raise taxes to eliminate these deficits, they said every American would essentially have to double their tax payments on April 15th and all of the other federal taxes they pay. And then the Congressional Budget Office said that the impact of those higher taxes would be so negative for the economy, we cannot tax our way out of this crisis. And by the way, I strongly agree with that assessment.
And
You're going to have to pay for your own illnesses, and if it means we do a means test and we find out your assets and so
I was misinformed about the IRS punishing people who don't cooperate with Obamacare. The interview was quite something. The IRS is now going to have to enforce Obamacare. So if you say, flip it, I ain't buying it, then the IRS is the one that is going to make the determination whether you get fined or what happens to you. So again, the IRS is going to have access to information. That is not true. If you don't want to buy health insurance, the IRS has to see to it that you do. That's what universal health care is. The IRS then comes in and deals with that person. That's not true. Who deals with them? Who determines the fine? It's in the law. I'm asking you the simplest question in the world. If somebody refuses to cooperate, who fines them and you can't tell me? And he couldn't. So what is the truth of the matter? I hope Mr. Weiner has a pen. Number one, beginning in 2014, the IRS will be the primary enforcement arm of universal health care, and they might need 16,000 new agents. If you don't buy health insurance, the IRS can fine you. That is, take part of your tax refund up to 2.5% come 2016. For some people, that's huge. Number two, the IRS will have control over who does and does not purchase health insurance. We hear that you will have to tell the agency your insurance status on your tax returns. Number three, the feds can punish you in other ways if you don't get a tax refund. If you're receiving any other federal benefits, they could take them away from you after checking first with the, ready, Congressman Weiner, IRS. So you can see that the Internal Revenue Service will greatly expand its power under Obamacare. So I believe I was correct in my assessment, and Mr. Weiner was a bit confused. As always, we're ready to receive facts to the contrary. The importance of the IRS deal is the constitutional challenge to Obamacare. Does the federal government have a right to demand that you buy anything?
yes, sir. Wall Street Journal. You make it simple, but it's scary. Thanks, Steve.
It is scary. See you soon.
That's seriously sobering, John.
Yeah.
And so we ask the question, is the world broke? We're talking taxes. How about this one, America's first federal tax on tanning? It takes effect today, a 10% tax tacked on if you use a tanning bed. It's part of a health care reform law that has passed, as you know. Well, tanning salon owners are already feeling the burn of the bad recession, and they fear the new tax could cripple their struggling businesses. Fox Business Network's Ashley Webster live from Beach Bum Tanning and Airbrush Salon in New York. I was going to make sure that you were wearing the protective glasses, but I guess your camera is, Ashley. How is the traffic there, given the fact that this tax has now passed?
Yeah, Jamie, you're absolutely right. Let me get out of here. It's not for those that are claustrophobic, and let me take those glasses off, and I'll take those off there. It is certainly going to affect traffic in these tanning salons, Jamie. Basically, that 10% tax, something like this. This is the dome machine, and people staying here for up to 12 minutes. It's $36 per session, by the way. That now goes up to $39.60, all part of this new tax that was tacked on at the very last minute to the Obama health care bill. In fact, what happened was you had the tax originally was going to be on cosmetic surgery, the Botox as it was dubbed, a 5% tax. That got lobbied out of the bill, and then what happens is the tanning salons got hit with this 10% tax on each session. And of course, what's happening for the tanning salons is that they say they are being unfairly singled out, and it will affect businesses because it does not include tanning beds contained within gymnasiums. So if you have a gym membership and you use the tanning bed in those facilities as part of that membership, you're not going to pay tax. So not only is it unfair, Jamie, it's also very confusing.
Sounds a little discriminatory, actually. So what will the tanning industry do about it? Are they going to fight it, and can they?
Well, they would like to, but they say because they do not have the lobbying power that, for instance, those plastic surgeons have, they are pretty much at the whim of lawmakers, and they say it's just so unfair. They haven't had the money or the organization to fight back. But they do say what could happen is a lot of businesses across this country could be out of business because